agrees with John McCain's proposition. And here's why. First of all, the average family health care plan costs about $12,000 a year. So if you've eliminated the employer deduction, the employer is now dropping health care benefits for you. You've got $5,000 in your pocket, but you're going out there and it turns out that the average plan is costing you $12,000. You're short $7,000. So I think more people would not have health insurance. Now here's the other thing. When you go out in the marketplace as an individual, you have almost no negotiating power with the insurance companies. Part of the reason that oftentimes working in a company like GM gives you a good health benefit is because there's so many employees there that insurers want their business. And so what ends up happening is that you got to take all comers. Anybody who's employed at GM is going to get insurance. If you're out there on your own and you've got what they consider a pre-existing condition, if you've had some health care ailment, you're going to be out of luck. In fact, as I think Elizabeth Edwards pointed out when John McCain first came up with his plan, she said, Senator McCain and I, neither of us would be able to get insurance on the private marketplace because he's had melanoma. Now, obviously, Elizabeth Edwards is stricken with cancer. Wouldn't be able to buy insurance on the private marketplace, no matter how much you pay, probably. Or it would be so astronomical that it wouldn't even be insurance. So I think that a voucher plan of that sort is a bad idea in the private marketplace, and certainly applying that same principle to Medicare, I think would be a mistake. Now, we do have a real problem in that our healthcare system is not as efficient as it should be. And there are ways of us encouraging efficiencies in the system. One of the ways we should be doing it is to emphasize prevention by making sure people are getting regular checkups, people are getting regular screenings. You know, I was down in St. Louis at a hospital. I worked as a nurse for a morning, and I have to tell you, you're glad I'm not looking after you. There was fortunately another nurse there who was supervising me, but I had a chance to talk to the CEO of the hospital. This is the largest hospital in St. Louis, and he said that they have significantly reduced their healthcare costs just because they force their employees to get regular screenings, regular checkups. They enroll them in smoking cessation programs. They enroll them in exercise programs. All that makes a huge difference in terms of the healthcare system overall, and we need to encourage those things. If we went back to the obesity rates that existed back in the 1980, Medicare would save $1 trillion overall. $1 trillion. That's how much of the increased cost is accounted for by higher obesity rates because of heart disease, diabetes, and so forth. So that's something we have to deal with. Managing the chronically ill, making sure that we're negotiating with the drug companies for the cheapest available price on drugs, improving the use of medical technology to reduce errors and reduce bureaucracy. All those things can wring out some of the waste in the system, but that way we can preserve Medicare as it's currently.